Hi everybody, welcome back to Dr. Shante Health Talks. I'm Dr. Shante, the Holistic Pharmacist. The title for today's video is The Naprapath, not to be confused with fill in the blank. So the first practitioner on the list that we should be confused with is the Doctor of Naturopathy. This person has their name with the initials following their name of ND. N is in Nancy, D is in David. And oftentimes, naprapath and naturopath sounds the same. So I like to say naturopath or doctor of naturopathy. I don't say the natural doctor because naprapath exists. We practice natural medicine too. So I don't say that. I try to give a clear distinction of who I'm talking about because it sounds the same. And you find that in pharmacy where there's drugs that look alike and they sound alike, but they're not the same, okay? And in most cases, not even close. But in the case of the naprapath and the naturopath, I like to call us cousins because of the similarities. We're both involved with natural healing, natural medicine, nutrition, and even naturopaths have adopted certain modalities and gotten certifications in certain things to help with pain therapy. You may even find that some naturopaths often they may practice as massage therapists, acupuncturists, to be able to provide more services to their patients because they're preventative care. Okay, and I'll go into the differences between the two. Okay, because I mentioned insurance. If you're seeing a naturopath, then they're probably not going to be billing your insurance, not by themselves anyway. They may sometimes work under a naprapath or work under a medical doctor, an MD, through them to be able to bill patients' insurances, but not on their own. They are direct access practitioners because you can walk off the street and go to them. A referral isn't needed to see them. And in the same cases for us as well. The naprapath, and we are the DN, D is in David, N is in Nancy. We are direct access practitioners too. You don't need a referral to come to us. You can walk off the street and come into our offices, okay? However, we are licensed in the state of Illinois. So we can bill insurance for our services. But it's not to say that everything that we provide service for is going to be covered under the insurance. And that pretty much kind of applies to many of the practitioners that even accept insurance. So those are one of the main differences between the naturopath and the naprapath as it relates to patient care, being able to bill insurance, okay? There are many schools and naturopathy programs throughout the country, in this state included. I'm sure you can Google it. I don't have a lot of information on that because I did not go that route, but you can totally Google it and find out what those avenues are and how to get into those type of programs. But I do know more about the naprapath because that's where I ended up. Okay, and naprapathy is practiced in 2 states. Okay, it's a very small profession. It's been around since 1907. And if most of you dropped your jaws, I'm like, really, 1907? Well, naprapathy has a story to tell, and there is a reason why people haven't heard from us. And I'll go over that in another video when I'm talking about what we do specifically. But I did want to, and let me go on and finish the differences as well. Now, some naturopaths have become a little eccentric, in my opinion, and it's just my opinion. When it comes to their treatment therapies, again, there are some that just acupuncture or acupuncture without needles, and they become licensed in other things like massage therapy or acupuncture so that they can bill and still be able to provide care how they learned from their curriculum, okay? Mainly natural healing, probably a lot of supplements, nutritional therapies, and sometimes what I might have seen with the naturopath is they kind of practice like the MD, but with supplements. So they may load people up. They'll come to my office and they're saying, oh, I see a naturopath, and they have all these supplements. So I look and go, wow, so this is the equivalent to the MD, but on the natural side, so they're just loading them up with all of these supplements. But anyway, that's not everybody's case, and I'm certainly not trying to diminish their role or legitimacy as practitioners. I'm not doing that at all, and I don't want to come off with that impression at all either. So that's what the first practitioner I want to talk about, the naturopath. Naprapath is not to be confused with the naturopath, okay? Because one of the things that we do within our scope of practice, that's not just nutritional intervention or functional medicine, but it is also physical medicine, okay? And I'll get into that again because I'm moving on to the next practitioner, okay? Naprapath, not to be confused with chiropractor, okay? And even though the naprapath, our founder of naprapathy, Dr. Oakley Smith, began as a chiropractor. He did, okay? And we'll go into those histories at another time, but he evolved into what he created as the naprapath, which is the connective tissue specialist. Because being that type of specialist, I believe that's what's giving us the distinction from the chiropractor, because we treat a lot of the same things that they treat, but we do it a bit differently. So anybody that's ever went to a chiropractor and then they came to a naprapath, you know exactly what I mean when I say that. And again, another separate video later, but I do want to make that distinction, okay? Because the treatments are different, but in the similarities, we both can correct and align the spine, okay? The next practitioner that the naprapath is not to be confused with is the physical therapist, okay? Very similar because we practice physical medicine. Right? Physical. We're getting physical, manually. We're manually going in and we're doing something. You're in pain, you're stiff. Maybe we're going to prevent some type of surgery. Maybe we are rehabilitating you after surgery. Okay? So you're going to see us and we're using some of the same modalities that physical therapists may use as well. What is a modality? In most cases, it's a piece of equipment to help and assist in facilitating your healing, okay, or reducing your pain. So that could be the ultrasound machine, not the ultrasound that they use within the OB-GYN office, but one that is designed to reduce inflammation and pain levels in the body. The TENS unit, which is the electric stimulation unit, that's either going to block pain signals or I won't get into all of that. Cold laser, those are what we call the modalities. So anyone that's gone to a physical therapist, you may have had some exposure to those modalities, which you would still have the same exposure from us. But we're not the same two practitioners, and mainly because physical therapists are not manipulating or correcting the spine. That's not what they're doing, okay? And there's a lot of passive movements where they're showing you how to do certain exercises to reduce your pain, okay? Not going to get too deep into the physical therapist because people who have exposure to them, they know what I mean by that. But naprapaths, we conduct both active and passive movements. So there are things that we're going to tell you to do, but then there are things that we're going to do as well to correct any type of imbalances in the body, okay? The next practitioner that the naprapath is not to be confused with is the massage therapist. Okay, that's a big one. In our curriculum, we learn soft tissue manipulation. We learn a lot of techniques because we're trying to get to the spine. We're trying to get deeper for what we need to do because we're not moving bones by going bone on bone. We're not doing that. There's no high velocity cracking, thrusting. That's not how, but we have to get through those tissues to get to the tissues that we manipulate, the ligaments and things and the other connective tissue fascia, to align things the way that we need it to go. So a lot of times you may think, oh, I see the table in the office. Am I about to get a massage? No. So anyone that's been to a massage therapist and then they come and get treated by a naprapath, you learn that we are not the same practitioner.